And welcome back to Pittsburgh Living on KDKA TV. I'm your host, Carol Lee Espy, and today we are featuring 6 excellent tri-state businesses. Now coming up, we'll feature 3 guests from Pittsburgh Promise, Vibrant Pittsburgh, and Ansaldo, Dr. Nathan Lockery from Aspen Dental, and Cookie Harris from New Image Hair Clinic. But right now, let's welcome Dr. Ian Bulow from the Upper Cervical Health Center. Welcome to Pittsburgh Living.
Thank you so much.
I say that slowly because you have to, if you say it quickly, they don't get what we're talking about, the upper cervical region of your spine into your neck. So can you talk about what that is?
Sure, absolutely. So the Upper Cervical Health Centers, it's kind of drawn out, but what it describes is our goal is to restore health in people that have lost it. A lot of people are chasing health as this kind of this abstract, unknown thing that we might get in a pill, a potion, or lotion. But really, what we find is that health starts with your brain's ability to control this body of ours. And that main connection point is in your upper neck, which is called the cervical region of the spine. So upper cervical refers to the upper neck. And health centers, obviously, because our goal is to restore health for those that have lost it.
Well, we always learn in anatomy class early on that the brainstem is sitting right in there, isn't it? And so, and everything else comes down from there.
Most people recognize that our brain is what controls our body, but what's interesting is if you look at neurology, you've got the upper lobes of the brain up here, but what really drives your body and keeps you alive and runs your recovery processes and health and healing is actually right in between your ears, right in here. So that neck plays a critical role in how well your body functions.
And isn't that where we carry all of our tension?
Yeah.
I mean, if we're doing something wrong, and I was just telling you, my husband goes through this all the time. Keyboard, holding a camera, and it all is in here, and it freezes.
Oh, absolutely. The weight of your head is about 10 to 12 pounds, and what the research shows is for every half of an inch, it drops forward or to the side. It creates extra and extra tension, about 10 pounds per half inch of extra responsibility on those muscles up there. So it's no wonder when people say, I always hold my stress here. And it's like, well, yeah, because the head's tilted off to the side and forward, and it's creating this complex of tension. And we can get massage, and again, nothing wrong with massages, they're a wonderful therapy. But we can do a lot of things to help these muscles, but unless we get the weight of the head centered, a lot of that ends up coming back. So that's why, again, that's one of the reasons why we start at the top.
So how do you do that? How do you center that?
Yeah, it's a really complex process. Through a combination of infrared imaging and digital x-rays, we're able to fully assess the situation of the upper neck. And it's not just a matter of a quick assessment and we'll just kind of go in and move things around. This is a matter of really painstakingly measuring every angle and every facet of the alignment. That way we can go in extremely accurately and very gently work with the alignment. So as a chiropractor, we use our hands, but in our procedures, we're very, very precise. So there's not any gross manipulation that you might find in an osteopath or a physical therapist's office.
I think that's what people think goes on.
Yeah, most people, when they associate, when they think about chiropractors or osteopathic manipulations, they have the association of having the neck.
Someone's twisting your neck.
Sure. And within the upper cervical world, not that there's anything wrong with that. It has a place and time.
Right.
But in upper cervical, we choose to take very detailed x-rays so that we can come in at the perfect angle and very gently correct the alignment without any of the turning or twisting.
Now, is that done, do you make a plan to do this over time, or can that be done?
It's a phenomenal question. Some people can actually be realigned with one procedure. But the recovery period after that always takes time. I mean, it takes time for your body to learn any new habit. So when you restore proper alignment in the spine, there's a recovery period, and that's different for everybody, depending on the level of damage that was originally done.
Now, you do work for post-concussion work, and we see so much of this going on because all of our kids are involved in sports, and sometimes a little too soon than they should be. But we're seeing a lot of concussions.
Yeah, I can't tell you, honestly, I can't tell you how many kids that we've seen recently, and it seems like in our office, when it rains it pours. When you have one condition, you see a lot of it, and in the last few months, it has all been post-concussion syndromes. Primarily off the top of my head, I can think of 3 examples. One was a young girl who was a figure skater, right? And a couple years ago, she landed on the ice, hit the back of her head, and her scores on that concussion test just plummeted. Chronic headaches, a lot of just aptitude problems.
Vision problems.
I mean, the vertigo. And you can imagine as a figure skater, having your balance is so important.
Key.
And she'd been to all the specialists. I mean, she's gone to the concussion centers and seen the doctors and everything. And her mother stumbled across our office through a friend, and she's been doing great. She's been doing great. And that's how it happens. The tragedy is, unless people are seeing this interview, most of them don't find our office unless one of our patients refers them. It's primarily a word of mouth kind of a thing at this point in the city. And just the other day I talked with another mother whose kid plays soccer. That's a young boy who plays soccer.
A lot of concussions in soccer.
Tons. I mean, all the head balls and everything like that. And I mean, you're talking terrible vertigo. This young guy had just terrible vertigo. He couldn't partake not only in soccer, but in the school plays and everything. And now he's totally fine. And his mother told me the other day, she said, you have got to raise the awareness of what you do in the sporting associations and in the schools, because there are tons of parents just like me that are at their wits' end because their kids are in these sports and getting banged around.
Yes.
And
what quite a bit of it.
Absolutely. And the reason is because when you have a concussion, the brain is actually kind of rattled.
It moves around in the skull.
Absolutely. And so it swells and it creates a lot of pain and disorientation and things like that. So we go to the concussion centers and they might give us medications or they might monitor, but at the end they wait until that brain swelling goes down.
Right.
But what gets left behind is the damage and swelling in the upper neck, in the lower portion of the brain. And that very often gets misdiagnosed.
That's the residual pain.
Absolutely. Absolutely. And I mean, if you just take a look at someone like Sidney Crosby, I mean, that was national media coverage. He had a concussion.
And how long he was off the ice. And we were so aware of that.
And he didn't get back on the ice until he had this looked at.
Yes.
That was one of the first things that got him well, was going through some specific chiropractic care. It's not that the medical care is inadequate. It's phenomenal. But there are limitations. Just like I can't diagnose someone medically, I can look at them upper cervically where perhaps their medical doctors cannot or aren't trained to.
Understand that.
And so it's just a matter of awareness.
So now you are offering free consultation?
Yes.
Is that what we're hearing? Okay.
Basically, we've changed kind of how we do things in our office. And what we offer now is that if someone wanted to, we are a couple times a month, we have an opportunity that they can come up and meet with me. And we just do a free consultation type of environment where they can sit down, we'll explain what it is that we do, we'll hear them out with what they have going on, and we can see if it's a right fit for them and their family and in their situation.
Right.
If it's not, if we determine at that point, you know, this seems like something that maybe is more of a medical issue, or maybe is more of a nutritional issue, or maybe is more of a therapeutic issue, we can refer them to those sources. However, if through their history we determine that it could be something going on in here that's at the root of the problem, then we can move forward and take a more detailed look at that area.
And then we have people out there pain-free, no more vertigo, post-concussion. It's wonderful. Well, thank you so much for being here.
Absolutely. It's always a pleasure.
Now, if you would like to know more about the Upper Cervical Health Center, you can call Dr. Bulow at just 724-772-7060, or you can log on to uppercervicalcare.com. Now, if you would like to advertise your products or services on Pittsburgh Living, you can give us a call at 412-575-2400 or email us at showcase@kdka.com. Well, up next, we will talk to 3 guests from Pittsburgh Promise, Vibrant Pittsburgh, and Ensaldo about attracting diversity to Pittsburgh. That's next when Pittsburgh Living continues.